It's not a regular call day for Dr. Amiene Miriabu. She's got an appointment with a patient outside of the hospital. Amiene works at the primary healthcare center, but on the side she's enrolled on a new platform where older people can get medical attention in the comfort of their homes or offices, and at a time most convenient for them. It's the product of a mobile app called GeroCare for people like Mike Ugwanyi who are in their 60s and above. Although still a practicing lawyer, Mike takes his health seriously. He enrolled on the GeroCare app program weeks back, and this is his second meeting with his doctor. The app links patients with doctors at close proximity. The patients receive undivided attention from the doctors. But not just that, it's relatively cheaper than going to a hospital where people have to wait hours before seeing a doctor. In spite of the many gains, there are still some strong concerns.
Are they affiliated to hospitals that have decent facilities where you will be taken to and you won't be on the queue for ages before you get attention? So these are the key issues they need to also address to also raise our confidence in them.
But developers put those concerns into consideration when establishing links with hospitals across the city. And for doctors like Amiene who are registered on the platform, the experience has been quite rewarding, providing healthcare services for the aging population who were not originally considered in the grand scheme of things.
There's a need. Elderly care is missed, as in there's like a huge gap. Unlike pregnant women and children, we fill all those needs. Pregnant women, when they go to the hospitals, they already have their VIP treatment. Children, we know that those are the areas we've been trying to take care of, but nobody's thinking of the elderly.
Abi Ofure is the brain behind GeroCare app. Abi, himself a doctor, had a bad personal experience that almost cost him the life of his aged father, and that spurred him to develop the app.
About 3 or 4 years ago, my father had a stroke. A year later, he had another stroke. You will assume that because I'm a doctor, I should have been able to prevent this, but it wasn't possible. Why? Because I don't stay where they are. And many of us fall into this same situation.
Here in Nigeria, the elderly constitutes nearly 20% of the country's population, but their mortality rate is also on the rise, especially in rural areas. Aside doctors being able to effectively diagnose and manage their ailments, assessing good health care has become increasingly difficult. That and the high cost too. It's one aspect to which key players in the health sector are beginning to pay attention to make living much easier for the aging population. Kelechi Emekalam, CGTN Abuja, Nigeria.